A successful international marketing executive, Barry Broughton has traveled the world and has faced a lifetime of challenges.
And then during the day I look after all of our business here in North America.
But few challenges would be as difficult as a diagnosis last year of prostate cancer.
I was horrified. Both of my parents died of cancer, and my sister has had breasts removed and so forth, so cancer is prevalent in my family, and it was a very traumatic thing to be told.
Barry discovered he had prostate cancer through a blood test called a PSA, or prostate-specific antigen test. It showed levels of a protein produced by the prostate in the presence of cancer had doubled.
Well, we talked about all the options for treatment. We talked about radiation, we talked about surgery and the different types of surgery, and went over all the pros and cons. And at the end of the day, both of us felt that for him surgery was his best option.
One of the things that we vividly remember is the feeling we had after our initial meeting with Dr. Ryder. His manner and his ability to explain the situation and explain in detail the treatment and the after effects and what can be expected. Julie and I walked out of that meeting, basically looked at each other and said, "We've found the guy."
Dr. Ryder and his team will remove Barry's cancerous prostate using the latest in robotic surgery, a minimally invasive technique performed through small holes in the abdomen. A well-lit camera guides the way. Dr. Ryder is at the controls at a console nearby.
The instruments have wrists, just like our own hands, so that they can move in all directions. They have all of what's called the degrees of freedom of a human hand. So it gives the surgeon much more flexibility and accuracy in terms of movement. Secondly, the conventional laparoscopy is done with two-dimensional viewing. So like when you go to a movie theater and you watch a movie, it's in 2D. You don't really get a sense of depth. With the robot, the surgeon is working in a three-dimensional environment. So it's like going to a 3D movie. So you have the added benefits visually of having depth perception. And that of course lends much more accuracy to what the surgeon is doing, and also a much more detailed picture of what's going on.
I wasn't cut from top to bottom or anything like that at all, and I was up and walking around the next day. If you've got to have cancer, this was probably the best experience you could have. And to have somebody like Dr. Ryder explain it to you and become part of your team, it really makes a huge, huge difference.
Barry quickly regained urinary and sexual function, but most important for wife Julie and their 3 grown sons, Barry is now cancer-free.
They've got the old guy still around for a while, and we're looking for grandchildren one of these days, so we want to be around to be able to enjoy them. So that's the deal.